exit? Should I leave this? I don't need to leave this meeting, Dr. Ali.
No, you just like
Ah,
be there. So
okay.
just like you're on the practice session,
Yeah, yeah,
you're in
yeah.
the practice. So you
Yeah.
just, yeah, you can just,
Leave
I
and
see I see your name is there, so should be okay. So we have like 8, 10, 9, 8, so something like that. We're okay, I think so.
inshallah. This now.
Bismillah ar-Rahman ar-Rahim. Ladies and gentlemen, thank you very much for attending one of the series of the Saudi Society of Medical Education's webinars. Today's webinar is going to be a little bit different and exciting, and it really matters to most of the educators if they are having a degree or they have an interest in medical educations. I have the honor to introduce Dr. Sadatullah Sayed. He is Assistant Professor of Oral Biology and Health Professional Educations, and he is in the Department of Dentistry at King Khalid University College of Dentistry in Abha. Dr. Sadatullah has an interest in medical educations, in particular in curriculum and assessments. He's going to talk today about a very important subject, which is a rubric. Without a rubric, maybe the assessment won't be that sound. Without a rubric, the learning processes won't be that powerful. So he is going to tell us about the role of rubrics in health profession educations, in particular enhancing clinical skills assessments. And without further ado, I will ask Dr. Sadatullah to start his presentation.
Thank you, Dr. Ali. Thank you for the generous words for introduction. As you know, I'm from Abha. I'm working in Abha. So this picture is depicting Abha in summer. Abha is very different during winters. It's very cloudy, misty, and cold. A must-visit place. I was telling Dr. Ali, is must-visit place if you have not already visited. So we already know the topic. We are going to talk about enhancing clinical skills assessment and the role of rubrics in enhancing this assessment. One second. Dr. Ali, can you see my slides moving?
Yes, they are moving. Go ahead.
Thank you. Thank you. So let's dive into the objectives for tonight's topic. Before I start, let me start with an assumption that we already have a basic understanding of rubrics and a basic understanding of their significance in the assessment involving subjectivity. So our focus today will not be on what exactly rubrics are, what are the types of rubrics. Instead, we will dive deep into the critical role of rubrics in assessing clinical skills, in assessing clinical exams. So specifically, we will see, number one, the risks and the consequences of not using rubrics while assessing clinical skills. And also we'll look at two approaches to create rubrics. One, the contemporary, the traditional method using analytic rubrics, and the other, we'll try to leverage the modern AI tools to develop a rubric, and you'll see how significantly simple the process would be and how time saving the process would be. So here's what I'm going to cover in, say, around 40-45 minutes, and then we leave 20 minutes for discussion, question and answers at the end. I'll do an overview of the key challenges in assessing clinical skills. So I'll try to talk about what are the pressing challenges, what are the most significant challenges faced by examiners while assessing clinical skills. So this will set us up for the significance of rubrics. After doing that, I'll talk about the consequences of not using rubrics. Then we'll look at the steps to create analytic rubrics. So analytic rubrics are the preferred type of rubrics for assessing clinical skills. And at the end, we will do a comparison of the traditional method of developing rubrics and AI-driven methods for the development of rubrics. And this, I'm sure, will be very interesting. And hopefully, if time permits, we'll do a quick demo of how to use the two most useful tools that I found on the internet for making rubrics using AI. Before we proceed, very quickly, we'll just get rid of the housekeeping points. Please mute your microphones during the presentation so that you avoid background noise. And feel free to post your questions in the chat box or ask them during the discussion session, question and answer session at the end of the presentation. Also, please leave your feedback so that it becomes a basis for improvement for us. Let's get started. Let's explore the challenges, the significant challenges in assessing clinical skills of students, and let's see how rubrics can help mitigate these challenges. So if you go through, if you search on Google or Google Scholar, what are the most significant challenges faced during clinical exam assessment? You will see number one, of course, not in any order. So you will see subjectivity and inter-rater variability as a huge challenge. You will also see feedback receptiveness, the way the students receive feedback from the examiners during clinical assessment is a challenge. Also, resources for assessment, you will agree with me, those who are course coordinators, course administrators, getting the right patient, the right number of patients, standardized patient for clinical exam. In getting the resources right for the exam is a challenge, has been a challenge always, and is a challenge always for educators. Also, cultural and contextual biases is a big challenge, especially while assessing communication skills and professionalism. For example, if the examiner is of a different cultural background and the student is of a different cultural background, this becomes a big challenge. Finally, time constraints. We never have enough time for clinical assessment, nor do the examiners nor the students. This is a challenge. Let's go back to the first two challenges that I mentioned here, the subjectivity and inter-rater variability and the feedback receptiveness. Subjectivity and inter-rater variability, you're going to hear these two terms a lot during my presentation because they pose a big challenge, and rubrics is one which will help reduce this challenge, help face this challenge. So subjectivity results due to the difference in the examiner's interpretation of the expected skills from the students during the assessment. So for example, for an exam, for a clinical exam, mini CEX, DOPS, or competency assessment, there are multiple examiners. The exam is going, say, longitudinally for a couple of weeks. There are, say, 3 examiners helping out with the assessment. So the interpretation of the skills that are being assessed, the criteria that are being assessed in the exam, for me, may not be exactly the same as the interpretation of my colleague. So when there is differences in the examiner's interpretation of the criteria, this leads to inconsistent scoring of the assessment, which in turn affects the reliability of the assessment. So now there are several ways to counter these challenges. And if you look at literature, the number one method they say is to standardize and structure the assessment thoroughly, meticulously, and use rubrics which clearly states what is required, what is expected from the students, and rubrics that have structurally clear, anchored descriptors. So we'll see in after a few slides what are descriptors. So what I mean to say is, to reduce subjectivity and inter-rater variability, a good rubrics is essential. The difference between subjectivity and inter-variability here is subjectivity comes when one examiner is examining is scoring the student's performance. So I can be subjective for several reasons if I'm the only examiner. So I can be subjective because a certain part of the exam was taught by me, or a certain part of the exam is of my liking, and many other reasons. Inter-rater variability is when the assessment is assessed by multiple uh, examiners, followed by another. Of course, this is not the only rubrics, is not the only way to counter the challenge of subjectivity and inter-rater variability. You can reduce these two factors by faculty calibration. So all the faculty involved in the assessment agree on same criteria and apply the same criteria for the assessment. And also you can have multiple examiners for the same assessment. For example, one student is assessed by 2 examiners. Of course, this is too resource consuming solution, but it is a solution nevertheless. Uh, Feedback receptiveness Learners, as we know, students are already stressed because of the exam. So whatever feedback is given during the assessment is lost due to stress or forgotten due to stress. So using a structured rubric becomes a form of a very good feedback for the students, which the students can use. That feedback the student can use to improve their performance and identify the gaps in learning. Uh, Again, the research, if you go through the research, it says inter-rater variability can be improved through clear specific assessment criteria. And before, for those who are living under the rock, rubrics are a set of criteria against which the student's work is judged. So it's just a piece of paper or a table, soft copy of a table in which the criteria and the performances are listed. And based on those performances and criteria, students' work is listed. Rubrics are basically the rubrics are they help in three ways. They serve three purposes. Number one, they help in improving the assessment reliability. So the assessment becomes more reliable, more transparent with the use of rubrics, number one. Number two, it helps in giving student feedback, especially in formative assessment. Number three, it serves as information for improving the quality of assessment, quality of teaching and learning. It provides those data points which can be used statistically to calculate the trend in the students' performances, and that can be used to plan better assessments and plan better teaching learning practices. So as you can see, clinical assessment is a humongous task, which requires a lot of planning, a lot of teamwork. Rubrics, a good structured, meticulously crafted rubric can address at least two of the challenges posed by clinical assessments, clinical skills assessment. And those are number one, reducing subjectivity, increasing the providing good feedback. All right. Very quickly, we'll go through we'll examine the consequences of not incorporating rubrics in clinical assessment. So if we are aware of the consequences, then we will be more motivated and encouraged to use these rubrics for clinical assessments. Number one, inconsistency in grading. So without rubrics, the grading becomes subjective. Subjective interpretations by examiners can lead to unreliable scores. And this is an unwanted consequence of an assessment. Number two, unclear expectations. Unclear expectations regarding the assessment from the point of view of the students and also the examiners. If both students and examiners lack clarity, then the exam is not clear, not transparent enough. So here rubrics helps in providing that clarity and providing those expectations for both the students and the examiners. The other consequence of not using rubrics in clinical assessment is insufficient feedback. So using a rubric, as I said, it provides specific feedback for the student's performance. So after you do the assessment, you have graded the student on a rubric, you provide the student with the rubric after the assessment. The student can have a look at each skill and at what level the student stands after the assessment, and then the students can amplify areas of improvement. Not using rubrics hinders student learning. It's very clear. If you're not clear with what is expected, if you're not clear what the assessment criteria are, then this impacts the students' learning. I've spoken about lack of transparency and accountability. Rubrics, they offer a criteria, they offer a framework for fair, transparent, objective assessments. So if you're not using rubrics, the absence of rubrics can raise doubts and concerns about bias in the exams. We've all seen this. Students, not all the time, but most of the time, they complain that my performance or my work was similar to my friends, but then I ended up getting less marks maybe because bias. So yeah, this happens. So rubrics can help mitigate this challenge. Missed opportunities for data-driven decisions. We have spoken about it. Using the analytic rubric, for example, you have a cohort of, say, 30 students, a batch of 30 students, and then you're doing, say, patient management, communication skill assessment, and then you collect all the rubrics after the assessment, and then you see that for, say, patient communication skill, most of the students lie under needs improvement. So having a rubric gives you those data points. If you don't have a rubric, you don't know exactly what the trend is with after the assessment. So all in all, not using rubrics for clinical assessment risks, number one, reduce reliability, reduce fairness, and overall effectiveness of the exam. So now that we know the importance of using rubrics for clinical assessment and the consequences of not using the rubrics, let's go into, let's see how a good rubrics is developed. As I said in the beginning, analytic rubric is a rubric of choice for clinical skills assessment. Of course, there are many types. Apart from analytic rubric, you have the holistic rubric, you have the target specific rubric, you have the generic rubrics that you download from the internet. So for clinical skills assessment, analytic rubrics is considered to be the go-to rubrics. An analytic rubric is a two-dimensional rubric with multiple criteria. It assesses the performance criteria components, the descriptors, individually, and then you add up everything to give an overall score, overall mark. So, and also it permits giving different weightage for different skills. So this is an example here on the screen. For lack of space, I've used only two criteria. Of course, an assessment will have more than two criteria. Say the first criteria is diagnostic skill, the second is communication skills. These are these criteria that you're assessing during the exam, during the assessment. And in the top row, you have the performance levels. Let's see how we prepare this, how we develop these rubrics in the coming slides. So steps in creating analytic rubric. Step one is writing the description of the rubric. So this is the gateway to the assessment. So you begin writing the rubric by writing detailing the giving the details of the assessment. This is the basic or the foundational step, which is most commonly, most often overlooked. It's not done. So you start with writing the assessment name. So it's a clinical exam, or it's a competency test, or a mini CEX, whatever. And then you go copy paste your CLOs, which are there in the NCAA course specific document, aligned with this assessment. So in the NCAA course specific document, you have your CLOs, and then of course you have the aligned PLOs, and then you have the teaching methods for those CLOs, and then the assessment methods. You look at what assessment CLO aligns with your assessment, copy paste it here. Also copy paste the PLOs from the same document. Now, this part is very important. It's very crucial, the aligning part, because this aligns the assessment with the CLOs and the PLOs and the teaching topics. So it completes the big constructive alignment loop. So by providing the CLOs and PLOs, you are completing the CLO PLO big constructive alignment. Also nowadays, we have the new ETEC academic standards and the key learning outcomes document. So with this, we have to ultimately align all the teaching learning elements, which is important for accreditation. So for those who don't like rubrics, it's bad news. For accreditation, alignment is important. For alignment, you have rubrics. So it becomes like a must thing for accreditation. And then later you specify the marks, whether you have critical errors or not. Moving on, the next step is to define the performance levels expected in the assessment. So what performance levels do you expect? These levels are displayed at the top row of the rubric table. And these can be 3, 4, 5, and even 2. So for example, if you, in your the context of your exam, the context of your clinical exam, you want to assess the students on 2 bases: clinically acceptable, clinically not acceptable. So you can have 2 performance levels also. So when defining the performance levels, you have to identify something called the anchors. What are anchors? Anchors are the best and the least expected performance from the students. So you think about what do you expect as a best performance from the students, and you think about what is the least expected performance from the students. And then you decide what should be there in between. So to help you decide the performance levels, you can use models like the Dreyfus model of skill acquisition, which provides with 6 stages of skill acquisition: novice, advanced, beginner, competent, proficient, expertise, mastery. Of course, there are too many, 6 are too many, but depending on the exam, the clinical exam that you are conducting, you can choose 2, 3, 4. Say, for example, if you're using 4, you can use excellent, good, average, pass, and of course, fail is there. Or you can use exceeds expectations, meets expectations, and needs improvement. But bear in mind, more performance levels, divisions, it becomes more difficult to write the descriptors. So we'll see what descriptors are later, but bear in mind that you should be very judicious, very careful when you decide the performance levels. The next step, step 3, is to write down the performance criteria. This is done in the first column of the rubric. So it's the first column, the extreme left first column. You write down the expected skills from assessed. You're going to assess in the exam. So, for example, I'll take a very vague example applicable for all clinical exam, which is diagnostic skills, communication skills, and problem-solving skills. For writing the performance criteria, you list the skills and the sub-skills if you have sub-skills in your exam, and you make sure that they align with the learning outcomes, which you have already done when you write the description. And while writing the performance criteria, you have to be very specific and very clear. The language of the skill that you write should be very clear, very comprehensible by the students. And the skills or the performance criteria should be measurable. Of course, you don't put a criteria which you can't measure during the exam. The last step for writing or developing an analytic rubric is to write the descriptors. According to me, undoubtedly, this is the most critical and most challenging part of developing a rubric, because you already, for the performance levels and performance criteria, you already have a list in your mind of what skills you're going to assess. To write the descriptors is a skill of another level altogether. So for the descriptors, what are descriptors? They are what you expect from the students for each criteria under each performance level. So let me go back very quickly and show you what descriptors are. So these, the text in the cells of the rubric table are descriptors. With the descriptors as well, you think of what you're expecting from the best student, or what is the least expected performance from the student. You think of that, and then when you think of the best performance, you write down the descriptor, and then you level it down to the number of performance levels you have decided. Or there's no hard and fast rules, or you can think of an average student, and then you level up on one side and you level down on the other side. For this, there's a very useful, very valuable tool on the internet. You can screenshot this slide, and there's a downloadable PDF called AAC Rubric Wordsmith. This wordsmith, it provides words that describe the various levels of performance. So for example, this is how the AAC or rubric wordsmith looks like. For example, for my assessment, for my exam, for the first criteria, for the first skill that I'm assessing, say, for example, communication skill, I'm going to use, for the best performance, I'm going to use the word, say, in-depth. So now this rubric, this wordsmith provides me the next level describing word, which says sufficient. And then the next level describing word, which says partial. And then the next level incomplete. So it's a very good resource available free online. So a few things you have to remember while writing the descriptors: ensure that each descriptor is different, distinct from the other. Of course, it doesn't make sense to have two descriptors having the having a similar meaning under different performance levels. Try to relate the descriptors to real life clinical settings for the exam that you're for the clinical exam you're conducting. For example, you don't expect from an undergraduate student, you don't ask the student to go to the moon and come back. For an undergraduate student, and for a postgraduate student, you used to have a different expectation and different real life clinical situation. And also remember that remember to provide examples if possible. In that small little cell, if you can provide an example for the performance level, it improves the clarity and expectation for the students. The descriptors should differentiate between good and poor work, of course. And while writing the descriptors, you keep in mind that your descriptors are going to be used by the student as feedback. So they should be specific, the descriptors should be specific and clear in language. So what I try to do is, of course, it's not that I started this, but I normally use a self-assessment column right at the end of the rubric. So if you can allow students to self-assess their work, to reflect on their work. So reflection is learning, and you can have a row below the skills, and you can provide feedback, specific feedback. So it's just not quantitative feedback, but qualitative feedback specific for the student for that specific criteria or skill. You can also include marks and weightage. Very quickly, what are the advantages of using analytic rubric? Number one, it ensures consistency in scoring. It allows scoring of individual skills and sub-skills, and it facilitates specific feedback. So very, very important, very, very useful informative assessment. It can be used for formative assessment as well as summative assessment. Disadvantages: requires more time, more effort, multiple revisions, and thorough planning. A few best practices while preparing an analytic rubric. Ensure the rubric is aligned with the learning outcomes for the nth time. Please try to use simple language that student can easily understand by avoiding jargons, acronyms, and short forms. Highlight the weightage if possible, if it's a formative assessment, so that student can focus on those skills that have more weightage and work more towards those than those that have less weightage. If possible, use separate rubrics for different procedures. There's this good article published in 2023. It says it suggests you can have different rubrics for behavioral skills and different rubrics for core discipline skills. Of course, it's not a must. The same article gives examples of rubrics with both skills together, but suggests that if it's better, if possible, we can separate them. Also involve the faculty while preparing the rubrics. So while you're preparing the rubrics, you're calibrating the faculty calibrations is going on. Also, if possible, include students' feedback. Holistic rubric, I'm not going to go into the details. This is how it looks like, one-dimensional. All criteria are clubbed into one, so you don't have different descriptors. Combines all the description, all the criteria, and gives marks, gives one overall score. And the criteria are written in sentences or mini paragraphs. Advantages of using holistic rubrics: they focus on overall quality of the student's performance rather than commenting or assessing specific skills. Scoring is faster, it's easier to create. It's good for summative assessment, where you're not very much worried about providing specific feedback. can be used in high volume assessments. So the disadvantages of using a holistic rubric is you score several criteria and give only one score. You assess several criteria, give only one score, and there is no real feedback. Let's recap very quickly the steps we have covered so far. To write an analytic rubric, you write the rubric description, then you define the performance levels, then you list the performance criteria, then you write the descriptors for each criteria. To make life easy, there are several tools on the internet which can simplify your efforts in preparing the table. So, for example, there are a few Rubistar, Quick Rubik, Teachonology, and even Blackboard is there, which helps you make a table of the rubrics. But these tools, they allow you to enter the details. For example, you have to enter the performance levels, you have to enter the performance criteria, the descriptors, and then what all they do is they just collect all of the information and then they make it into a table. So,
Dr. Sayed, there is a question from Abdul Had Khan. He was asking, can we have a description with an actual example from any course so it will be more clear? So that's he put his questions in the chat box.
Yeah, thank you so much. Yes, it is advised, it is suggested, recommended to include examples in descriptors. For example, in my assessment, I say that the student should be able to, the ability to demonstrate such and such, and that's it. I leave it at that. But if I say ability to demonstrate such and such, and then I give an example, the good side of this is it becomes easy for the student to understand the descriptor. But the flip side is you require a lot of space. If the example is too long, you require a lot of space. So for these, what we have seen, or the experience that we have in the department while we go through rubrics, either we give an asterisk if the example is too long, we give an asterisk and we include the examples at the end of the table, or you try to condense the example and you push it in the descriptor. You do the same thing with if you have a list of skills sub skills that you are assessing under one skill. So you don't write all the skills in the descriptor. So you say the student was excellent. You use a descriptor excellent or comprehensive in performing all the steps, and then you give an asterisk and you list the steps. So similarly, for examples, you can do that. The short answer to the question is it is recommended to include examples so that increases clarity, and if the descriptor is clear, it becomes a solid feedback for the students. I hope I've answered the question, Doctor.
Yes, proceed. Thank you.
Thank you so much. So yeah, with these tools that I have listed here, you still have to provide the elements for the rubric. So what they do is they just collect your information and they provide a table for it. Dr. Ali, can we have an opinion time now? So I want all of you to think from your opinion, is using AI-powered tools a good idea for developing rubrics? So if you're given option to develop a rubric the way we have been developing so far, thinking of the program, the levels of performance, the descriptors and all that, or you're given a chance to use AI tools to develop, what would you choose?
So, Dr. Said, we're going to give them maybe 1 minute. It seems like they are already putting their participations, but we're going to give them a little bit 1 minute, and then we're going to, maybe tell you about the result and about it.
Sounds good. Sounds good.
almost the majority of the participants, they've already picked the first choice already. So it is a good idea, something rather not surprising though.
Exactly. It's not surprising because I picked this quote from the internet. Not using an AI now is like sending a message by a carrier pigeon instead of using an email. You can do it, but inefficient, and then you'll have to feed the pigeon as well. The same applies here with the AI driven tools for developing rubrics. So if we are not open, if we are immune to using AI tools for developing rubrics, my belief is we will become outdated soon. I'm not promoting using AI tools to developing rubrics only, so we have to use our own revisions and all that. So, but I suggest, see, it's 88% yes. 88% yes. That's nice. Thank you, Dr. Ali. So if you, I did a shallow research on internet on the AI tools available. So I found these two to be very useful. Number one is ChatGPT, of course, the mother of all AI tools. And the second one is called the Teacher Dashboard.ai.
Yeah, just like before you proceed, Dr. Javid Wani, he said artificial intelligence tool can be used to generate the rubrics, so he agrees with the notion that can be used, but needs to be modified according to the objectives.
Doctor, I can't agree more. I was about to discuss after we go through the procedure to use AI tools. I was about to discuss not two, three points about the not the disadvantages, the issues when we use AI tools to develop rubrics. So one of them, as you said, is it's not specific. So what AI is doing is what information it already has is regurgitating into a table form. So we'll come to that after we see how to use the rubric, how to use the AI tools to make rubrics. Is that good enough, Dr. Ali, for the answer?
Yeah, I think that's a good enough. And maybe he will be convinced as the information is going to prevail when you continue your presentation. Thank you.
Most certainly, yeah. So very quickly, if you are willing to use ChatGPT to develop an analytic rubric, I have used, trial and error. I've used this prompt that is there on the screen. You can screenshot this prompt, enter this prompt in ChatGPT, and within seconds you will see magic unfold. So what you have to do is you write, create an analytic rubric table for and the text in yellow, you replace it with your exam, whatever it is. It's a competency assessment or whatever assessment it is. In your field, provide the field, medicine, dentistry, nursing, whatever, including the following details. And the first point, you provide the number of performance levels you are expecting in your rubric table. So if, for example, in my case, I want 4 performance levels, and then I give example, excellent, good, satisfactory, and needs improvement. By the way, if you don't give the example as well, ChatGPT somehow gives you the performance levels itself. But yeah, if you have them in mind, it's better to give it. And the second point, you write the following performance criteria, bracket open example, and then you write the skills or the criteria you're assessing through the exam. And within parentheses, within bracket, you can give the percentage you want to give for each criteria, for each skill. The third point you write in the prompt for ChatGPT is descriptors for each level for all criteria with examples where possible. So this answered the first question. So I was amazed when I was preparing for this presentation. I was trying out many different prompts. It tries to give, ChatGPT gives examples. Of course, not all are correct, as the second question we had. Not all are correct. They are not relevant sometimes. Sometimes they are relevant but very vague. So the example is there, but not very useful for the student to have a clear understanding of the descriptor. But nevertheless, you can give in the prompt, you can write with example where possible. And number 4 is maximum marks must be if this is a summative or formative as well, and you have marks for the assessment, you put the marks for it, and then you say and weightage distribution for each criteria. Copy this, paste it on ChatGPT, click enter, and you have it. The next tool is teacher dashboard.ai. The D is missing here. So this is another good tool, though it is not specific for health profession education. ChatGPT is also not specific for health profession education, but the results are they are good for as a starting point. For teacher dashboard.ai, please excuse me for the mistake. It's dashboard with a D at the end. Dashboard.ai. You have fields to enter. You don't give a prompt. You have fields to enter information. So the first field is title. So you enter the title of your exam. The description, you write rubric for the following criteria for following exam. And then you enter the grade. You enter the course or the subject. This is very amazing. This tool doesn't require to give the criteria for the rubric. What you need, what they want is the learning objectives. So when you give the learning objectives, the AI it thinks and gives you the criteria from its side, yani. So it's amazing. So Dr. Ali, do we have time for a quick demo? Can we?
Yes, we do. We have like 15 minutes to go, so please do.
Right. All right. So I'll stop sharing this. Dr. Ali, can you see the page for ChatGPT here?
Yes, I do.
So what I have done
Please.
is, thank you so much. So what I've done is I copy pasted the prompt that I showed you in the PowerPoint slide. I've copied the prompt and I'm going to paste it now here in ChatGPT. So the prompt is here. So I ask ChatGPT, create an analytic rubric table for a final year clinical assessment, and such with 4 performance levels, all that I showed you in this slide. And then I click enter and I wait for the magic. Of course, whatever ChatGPT is giving here is not perfect, requires revision, maybe requires overhauling, maybe, I don't know, maybe just junking the whole thing. But as you can see, what it has done is it's tried to give me examples. Say you say example overlooks major decay. And then say aseptic technique inconsistently applied. So it does quite a good job. What I feel is using AI to, especially ChatGPT, to create rubrics is a good starting point. So you can make your first rubric using ChatGPT. Then you can have a faculty calibration meeting. You can ask your colleagues to join you on, improving and developing the existing the ChatGPT rubric you have. And of course, you can ask students as well. So that's how you can use this. I'll go back to my slides. Stop share. Oops. Oh, I'm sorry. I've gone to the first slide. So yeah, that's how you use AI. Before we wrap up, please consider these 2 reflective questions. one from the point of view of the examiner, from your point of view, one from the point of view of the students. I'll read them out for you. Does over-reliance on rubrics compromises the foundational teaching and learning philosophy of higher education by reducing the examiners to mere technicians whose role becomes limited to following the predetermined grading matrices, the predetermined descriptors? So the question here is, you using rubrics make us make our work mechanical. We just look at the performance of the student, and then we look at the descriptor that's there on the rubric, and we mark and give the score. So think about this, and maybe you can have a discussion in the question and answer session that will follow. And from the student's point of view, do rubrics limit the depth of student learning by encouraging students to focus only on meeting the specific criteria that we put in the rubrics, rather than fostering critical thinking and creativity, rather than students thinking out of the box and performing creatively? So these are the two questions that I pose as reflection for you all. Thank you for your time and attention. As me and Dr. Ali had decided, we'll keep it to 45 minutes. I hope I've restricted to 45 minutes. I sincerely hope the session was useful for you. It has provided valuable information, the information you were looking for when you registered for this webinar, and I hope it helps you in enhancing and improving your rubrics. Dr. Ali, can you open the floor for questions?
Yeah, sure. Thank you very much, Dr. Said. It was really awesome and simple, and it is very kind of the most important information was disclosed. Lots of practical stuff. I love the way you showed the audience how to do rubrics, and it's beautiful. And if anybody of the participants want to share questions, ideas, please feel free. I can allow you to talk. So just like raise hand, and the mic is yours. We'll wait for the people if they want to ask any questions. I have for you, Dr. Sayed, two questions. Number one, there is the competencies. You've decided some of it, like the communications and the diagnostic stuff. You put a percentage. Can you just tell us how we decided on this? Is it up to you or up to the curriculums, or how can we reach this percentage in the rubric?
Thank you, Dr. Ali. That's a very important question. So before we even start developing the rubric, we have to undertake a huge task, which is called test blueprinting. So there is a method called frequency and impact method, where we use the perceived frequency of the topic that we're teaching and the impact of that topic on the student's real life experience. We decide the weightage of the topic in the assessment. This whole process is called test blueprinting. So hopefully, if this webinar is perceived as successful, and hopefully if I'm invited again, we can do another session on test blueprinting. So at the end of the process of test blueprinting, we have, again, as a table, we have we get percentages based on scientific evidence for each topic to be assessed in the exam. I hope I answered the question.
Yeah, you did. Actually, that's a very important, and for sure, you're always welcome to be part of our group and give us a talk. Really, it's an honor having you, Dr. Said. And I don't see anybody is raising hands. However, I do have another question, since the lecture is very interesting, and I love what you've just presented. You always talked about, grade, marks, and this up. things. In your discussion, you mentioned something called like mini CX and other work-based place assessment. And I remember at the beginning of your talk, you talked about formative assessments. So are we able to do rubrics for a formative assessment purpose without doing the marks? Because the marks is always, I want to get 90, I want to get 80. So that's something maybe it's not, does not serve the purpose of a formative per se. So I'd like your opinion here.
Thank you so much, Dr. Ali, for the question. So there are two aspects to this question. Number one, should be or is rubrics helpful in case of formative assessment? And I'll add to it summative assessment as well. That's one part of your question. And when you're not giving marks, how useful is rubrics? Actually, is the whole idea of rubrics is based on two things. Number one, scoring. Number two is feedback. So in formative assessment, where your principal objective is to provide student with feedback. So formative assessment is assessment for learning. It's not assessment of learning. So it's for learning. So when you do a formative assessment, the most important thing that you as examiners we do is we provide student effective feedback. And rubrics, trust me, are very solid form of giving specific feedback for formative assessment. Now the question is scoring or not. Okay, you just leave the scoring part, or just say that student you're excellent in this criteria, and then you are still need improvement in this criteria. You don't score the student. But for summative assessment, where you are giving scores, and then mostly in our setup where we teach in my university, after the summative assessment, we don't provide feedback. So for the final exam, we don't really provide the feedback. We just give the student the score. Still, rubrics are very important in summative assessment because rubrics are useful before the exam, and they are useful after the examiner scores and gives the student the rubric. So before the exam, rubric lets the student know what is expected, what are the different levels of performance, what are the different criteria the student is going to be assessed, what are the different weightages the student has in the exam. So it helps in that way before the exam. Of course, in summative, you just give the scores and there's no feedback. So half part of the benefit of the rubrics is not there. So yeah, in a nutshell, yes, rubrics for formative assessment, for me, it's a must. For summative as well, but the effect of the use of rubric for summative assessment is half as much as the formative assessment. So yeah,
Excellent.
Thank you so much. Yeah.
Yeah. Thank you very much. Very well said. So I don't see any further questions. Lots of people, they have a very good positive feedback for you, Dr. Said. So thank you very much for sharing an important information, and we are going to see you again in a future talk among the webinars we organize at the Saudi Society of Medical Education's Riyadh chapter. I would like to take this opportunity to announce the coming webinars going to be on the 10th of December. It will be presented by Prof. Rania Zaini. And Dr. Said already talked about artificial intelligence. How about the physician's competencies in the artificial intelligence era? This is a necessity for today's and tomorrow. It will be a very interesting subject, and hopefully please register and join us. And we always be glad to have you in our webinar series. Thank you very much, Dr. Sayed. The last word is for you before we conclude.
Honestly, it's been an honor. It's been a privilege to be sharing my very little experience that I have with rubrics. It was an honor, and we had alhamdulillah, we had a good attendance as well. I would like to thank the messages. I was just going through the messages. I would like to thank, and I would also like to thank SSME for giving me this opportunity. And I'm looking forward for future collaboration as well. Thank you.
Thank you very much, and see you in the next webinar. Have a good evening to everybody. Thank you very much, everybody. Bye-bye.
Bye. Thank you.